Hi guys, today I'm going to be talking to you about the shoulder problems. There's lots of different things that can go on with the shoulder, but one of the most common ones that we see is a shoulder impingement. Shoulder impingement is when you have a muscle that goes down through the shoulder joint itself and it pinches on something. So I've got my friend here to demonstrate that. So you've got the side of the shoulder here and you have your shoulder blade. This is the back of your body here. And you got a muscle that comes this way and it goes through this hole, and you've got another one that goes from here and it goes this way. So the top muscle is called your supraspinatus, and this muscle down through here is called your infraspinatus. Now, where those muscles come and attach onto the arm bone around here, they can pinch or get pinched by other bits of anatomy, or they can become swollen and inflamed. Now, the symptoms for that are essentially pain around usually like the front of the shoulder, sometimes kind of around the side around here. It's normally painful when you're trying to sleep. So when you're lying in bed, you can kind of feel a lot of pain around the back of the shoulder or sometimes around the front. And you will struggle lifting the arm up. So a lot of people get this confused with frozen shoulder. I'll do another video about that another time, but in this one I'm just going to talk you through about the impingement symptoms. So like I said, you'll get pain when you try to lift it. So you'll probably get to about here, and it might be fine, and then also you can still move it, but it's catching around that area. So if you want to test to see if it is an impingement, there's some very simple tests you can do at home. They're not foolproof, but there's something you can do to give you an inclination or an idea if it is that type of issue. And what you can do is you can, let's say it's your right shoulder that's the problem, you put your right hand onto your left shoulder and try and lift that arm up. If you're struggling or you're getting pain doing that could be an indicator. The other one is lifting the arm up in front of you like this, but having your thumb facing down, so you try and lift the arm up that way. And if it's catching and if it feels like it's pinching, or if it's causing more pain in there, that can be an indicator for that as well. Another one that we would do normally in clinic is you'd sort of have your arm like this, and we would sort of start bringing the arm in, so we're kind of tipping it this way like that. So if you were to do this at home, you'd bring the arm up to about here and try and drop the arm in, but just give a bit of extra pressure as you come through this way. And as you get to sort of around the mid-body, if you're getting pain around the shoulder, some people will get discomfort anyway, but if you get pain around the shoulder, and especially if it sort of reproduces the problem, that might also be an indication of a shoulder impingement. So like I said, there's normally a couple of muscles that might be involved. Most commonly it's the supraspinatus. The infraspinatus, which is, like I said, is the muscle slightly further down of the shoulder. That can also cause an issue as well. Some of the kind of symptoms can be like you put your jacket on, so you might struggle to do that with your arm. Or the other one is putting the arm behind the back. That can also be another symptom as well of a shoulder impingement. So if you are struggling with any of those symptoms, a real simple tip for you to try and help with this is ice. It's one that comes up time and time again, but you want to be reducing the inflammation around the area. So just to bring my friend back in again. So talking about these muscles, so again, the supraspinatus is kind of coming through here, infraspinatus is coming this way, more like around that bit. And again, the arm bone sits about here. Where these muscles are kind of coming onto the bone here, it's probably going to be inflamed. So what we want to do is reduce the inflammation, and the nice easy way of doing that is just using ice. So that's something you can do to help with the symptoms through there. The other one that you want to do is you want to keep the arm gently moving. Now obviously if you're struggling to move the arm up that way, that can be quite hard. So you don't want to be pushing it to a painful direction, but that's something that you can try and do. Some people find like distraction quite useful as well in the arm. So some people might find that holding like a kettlebell on one side and then the arm kind of stretch down, it just helps to open the shoulder up a little bit. That can be useful, but I would be careful if you do that, because sometimes that can, if you go really heavy with it, that can make things worse. So you just got to be on the cautious side of things when you do that one. But that can also be another good one. But I would say first of all, just try ice and keep it gently moving. That's the first thing I would do. Now, if you're still struggling after a few weeks, we do see shoulder impingements quite often in the clinic. So our practitioners, our practitioners can take a look and see how things are with that one. What I would suggest is, if you're not improving after 4 to 6 weeks, it might need to have an expert take a look at it to see if it is a shoulder impingement or not. And if it is, then we can formulate the right plan of attack to get you feeling better